How are you?
I'm good. How are you?
It's doing well. It's so great to see you again and kind of take the time to have a conversation with you today. So thanks for reaching out. And I just want to make sure that we had this opportunity to kind of walk through some of the things that we previously talked about. So, Natalie, what brings you here today?
Well, I have been having some, let's see, I'm trying to find the right word to describe it. Me and my sister's relationship has not been the best. My
Okay.
older sisters, to be
Hmm.
specific.
Hmm.
We never really had a relationship. And I
Okay.
feel like the older I get, the more it's been like, yes, although I've always wanted to have a big sister, I
Okay.
feel like I'm sure she wants to have a relationship with me, but she doesn't know the best way to approach me.
Okay.
And I feel like, the fact that she is the older sister, so
Hmm.
it's her job to reach out to me instead of me trying to reach out to her.
Okay. Well, before we get started now, I just want to let you know that all information that will be shared in this counseling is kept confidential. It will not be disclosed without your written consent. There are, however, legal expectations to confidentiality. If there's a risk or serious harm to yourself or others, or if there's suspected abuse or neglect of a child, of course, or elderly person or dependent adult. If I'm required by law through subpoena or court order in such cases, I will do my best to inform you before any disclosure is made. Understood?
Right.
Okay, sounds good. So basically, I wanted just to kind of let you know a little bit about the type of therapy or the nature of the counseling that I use. I use a cognitive behavioral therapy approach, which is goal oriented and focuses on the connections between your thoughts, your feelings, and your behaviors. Sessions are typically about 45 minutes in length and may occur weekly or bi-weekly depending on your needs. However, today's session, we're going to keep it a little short so we kind of get to understand, more what are some of the things, the challenges that you're facing. So thank you for the opening and thank you for giving me some clarity in regards to what you would like to discuss today. So with that said, when would you say was the onset of this type of relationship between you and your sister?
Well, I feel like we never really had a relationship.
Okay.
Even
And
when we was growing up, I don't think it's the we. I think me and my older sister, we
mhm.
have like 12 years. We are like 12 years apart. I
Okay.
don't think it has nothing to do with the age gap. I just feel like she growing up, she was much closer to the one that was closer to her age instead of
Mhm.
me. So we
Okay.
never really had a relationship.
So, growing up, how would you say that made you feel?
I've always feel like left out because she would hang out with my older sister because I have like three older sister. She
Hmm.
will hang out with like the three older one. It's
Okay.
like me. I've always been like she always left me like in the back burner. Like, are you too young to hang out with us? I've always feel like, hey, I'm like pretty much like set apart from all of them. So
Gotcha. I almost can relate to that being the youngest child and having older siblings. So definitely sometimes that can be a little challenging and sometimes hard
right.
to navigate through. Would you say that this has been something that has continued over your lifespan as a child up until your adulthood?
Definitely, yes.
Okay.
But I
And have,
thought, as we get older, I thought it would get better. Now
mhm.
that all of us are like adult, but it's not.
Gotcha. So let me ask you this. Have you tried anything to try to bring some, not so much as closure to the relationship, but some opportunities for you to explore as adults now, if you can have a relationship?
I feel well. I have not explored any of that. I just feel like in my mind, I feel like she is the older sister. She's supposed to reach out. It's her job to reach out to me.
Okay. All right. So can you walk me through a recent situation that kind of left you feeling like, to your point, left out?
Okay, sure. So recently,
Mhm.
she reached out to my mother. She was telling my mother how she felt like she wanted to have a relationship with me, but I never given her the chance to have a relationship with me. She always wanted to reach out. And I'm like, well, she never reached out to me. And I feel like I have been on my own for the past 5 years, as her being the older sister. I feel like it's her job. She should
Hmm.
have, reached out to me, asking me, hey, how are you doing? Are you okay? She never done that. But the fact that she reached out to my mother and complained to her and say, I've always wanted to reach out to Natalie. I don't know. Maybe she probably was saying that she doesn't know how to reach out to me, or I'm not exactly sure how the conversation went between them.
Okay.
But my mother did mention that she was just saying that she wanted to reach out to me, but she didn't know how to.
Okay. So let me ask you this. Based on our conversation today, what would you consider would be success in this therapy would look like to you?
I just feel like if she reached out to me, maybe we could have like a conversation
Mm-hmm.
about it. But if not, then it is
Okay.
what it is.
Okay. So what would you like to accomplish with this session?
I do want to figure out to find ways.
Okay.
Well, I don't want to reach out to her. First I don't want to reach out to her. I want her to reach out to me. Maybe if she reach out to me, then we could have a conversation. But although yes, I want to have a relationship with her, but I don't want to make the first move.
Okay. All right, so answer this question. I have a question. So I understand, and I'm just going to paraphrase some of what you've said. You said that your sister's spoken to your mom. You said that you growing up, you felt left out because she has let's see, a more stronger relationship with another sibling who's a little bit older than you. So,
Yes.
and again, you said that you were like the youngest, one of the youngest children. So with that said, I would say that your early memory of struggling with this challenge, with this relationship with your sister, has been since your childhood.
Yes.
Okay. And with that, how has mom helped to close the gap between your relationship? Especially because you're so far in age. It sounds like she's much older than you. So how has mom worked with the family, right? Do you have any brothers or do you have only
I
sisters?
do. I have an older brother as well.
Okay,
Since
okay.
since I'm the youngest one, nobody really have done anything about it. We haven't
No,
talked about it either. And I
gotcha.
feel like if she have something to say, she just call my mother, and just relay it to her. And my
Hmm.
mother call me and pass down the information to me.
Gotcha. Gotcha. So tell me a little bit about your ethnicity, because it sounds like you guys are close, but not close enough.
Well, so I'm Haitian. I was born and raised in Haiti.
Okay.
So our family don't really like, we are not as close as other family. We talk
Okay.
as family every single day, but we are not as close.
Okay. All right. Sounds good. So we did talk a little bit before we started recording in regards to some of your family background, some of your family dynamics. So it all kind of makes sense, right? You have a Haitian ethnic background, which families can be extremely very close, very
Right.
clingy, or very far apart, right? So we kind of talked about that earlier as well. So with that said, family dynamics, is it important to you to have a strong family dynamic, or have you gotten to the point where you've gotten accustomed to it is the way it is now?
To me, it is. The older I get, the more I realize like I need my family, I need my sisters.
Okay.
But the fact that I don't have that relationship,
Hmm.
I pretty much trying to stick, that, having a sister to my friends, or to
Okay.
stick that relationship elsewhere. But
Right.
then again, I'm like, I still crave that relationship through my sisters.
Okay, so we've talked about your thoughts, your emotions, and your feelings, how it makes you feel, some of your behaviors and your reactions, your goals and your motivation. Let's talk about a plan. So maybe we can work together because, as you know, CBT is a model where it's very collaborative. We work together. The approach is very goal oriented, and we focus on connections between your thoughts and your feelings, but most of all, your behaviors. So let's kind of work on something you can do in the short term to kind of bridge the gap between you and your sister. And I'm going to paraphrase once again. You said that you didn't want to reach out to her, that you expected her to reach out to you. Is that
Yes,
because she's the older sibling? You feel that she
correct.
should? Okay, all right. So, would you be willing to make the first move and reach out to her first?
I don't want to reach out to her, but if I have to, then
Okay. So, how about we work on this first? Would
okay.
you be open to working on thinking about how do you feel about you first? That,
Okay.
in other words, you are loved. It sounds like you have a relationship with your mom. It sounds
Yes.
like you have a relationship with your dad. So you are loved. So first acknowledging that I am loved by my parents. And on the other siblings, because you referenced the eldest sister is the one that you would like to speak to at some point, but you want
Hmm.
to reach out to you. So with your other siblings, do you get along with them, or do you have a
Yes.
relationship? Okay. So basically, it's just the older sister, right?
She just the old, yeah, she's the oldest one and she's the only one. I don't know what her problem is, but I just feel like she see me as a threat. Like as the younger sister, it's like I'm expecting my older sister like to love me, to care for me, those kind of things, but
Mhm.
it's nothing like that.
Okay. How important is it for her or for you to feel like she loves you? How important is that to you?
It's not to me, it's not that important, but I just want to feel like hey, I have an older sister that cares.
Okay. All right. All right. So let's do this. Let's talk about a plan that would at least start creating a pathway towards a relationship with your sister. Would you be open to that?
Sure.
Okay, so I think what would be good is we want to make sure that we set the expectation for this your treatment. So one of them is going to be that we've laid the foundation, we created a baseline. I have a better understanding of your relationship with your family and all all that the dynamics. So I think in our next session it would be good if we can kind of talk about what those steps will look like. Does that sound reasonable to you?
Sounds great. Yes.
All right. Well, Natalie, I'm going to close out the session with saying that we've talked about what brings you here today is your relationship with your sister. We talked about how it makes you feel. We also discussed how long you've been feeling this way. And also we talked about what steps that you're going to take in order for us to create a pathway forward. Is that correct?
Sounds great. Yes. That
All
is
right,
correct.
sounds good. Well, what we're going to do is we're going to meet back probably in a week. Would you say a week is good for frequency? It's time for us to meet, or 2 weeks? What would be good for you, Natalie?
2 weeks will be fine.
Okay, 2 weeks. And is this a good time for you?
Yeah, this is perfect. 5:30. That's yeah, that's normally the time I'm off work. Yes.
All
That
right.
that's great.
And are you okay to meet virtually, or would you like to meet face to face from time to time?
Oh, face to face would be great. I don't
Okay.
mind that either.
All right, sounds good. All right, so I'll go ahead and have you scheduled for your next intake, and
Okay.
then we'll just continue, like I said, to move this conversation forward, but also to come up with ways for you to make sure that you feel loved and make sure that you come up with a way that you can reach out to your sister, but not until you're fully ready. Okay?
Okay.
All right. Well, thank you so much for today. And it
Thank
was been my
you.
pleasure to spend time with you.
Sam, thank you so much. Okay, how do I stop this?
Just stop recording.
Yeah, it stopped recording.
Okay.
Okay.
Now you have to send it to me. How long was it?
Recording. I guess I
You're
was.
now you're now only recording this meeting transcript. Wait a minute, we transcribe it or do we record it?
Oh my gosh, stop recording. Okay, stop.